transferring intensive care patients from one German region to another. Hospitals in parts of the country now overwhelmed by COVID cases, large numbers of them seriously ill. And today, the incoming German Chancellor confronted the country with the situation, imposing strict measures for the unvaccinated and warning that in February vaccinations could be made compulsory.
Es müssen sich diejenigen noch durchringen, sich impfen zu lassen, die das bisher nicht gemacht haben. Und das ist auch an dieser Stelle mein ganz persönlicher Appell, dass wir alle überzeugen, den Schritt jetzt zu gehen.
This vaccination centre in Dresden had been dismantled at the end of September. Yesterday it reopened with long queues. The unvaccinated are to be barred from all non-essential stores, cultural and recreational venues. And this is the Delta variant, but all eyes are on South Africa, waiting for more data on the latest variant, Omicron, as it continues to spread. In Gauteng province, the epicenter of this outbreak, cases are still rising sharply, as are hospital admissions. Omicron now displacing Delta as the dominant strain.
We are monitoring very, very closely, getting feedback from our clinical teams also on the full impact of this. As we see the numbers every day, we're very, very concerned about what the reports are from our clinical teams.
The World Health Organization said it was now investigating a 54% surge in COVID infections in Africa, though mainly they are in the south.
It's the susceptibility of the population that is greater now, because previous infection used to protect against Delta, and now with Omicron it doesn't seem to be the case. We believe that vaccines will still, however, protect against severe disease.
Some reports say the infections appear to be milder, but claims that this could actually be a Christmas gift were today given a short shrift.
We need to make sure that we really have doubled down on our infection control ahead of Christmas, because if they are wrong and we relax things, then Christmas could be much worse than it would otherwise be. These discussions about trying to alter the mix of variants in a country are, they're fanciful, and they are potentially dangerous and unhelpful, I think, for public health and everyone's benefit.
So while the world waits to see if the vaccines do protect against Omicron, many nations are stepping up their efforts. The Prime Minister himself receiving his own booster today.
That's 2 AstraZenecas and 1 Pfizer.
Indeed. And the UK has ordered 114 million more doses of Pfizer and Moderna vaccines, some of which could be modified against the variant. Forward planning, but against a backdrop of large parts of the world remaining unvaccinated.
And Victoria McDonald is with me now. Does Boris Johnson celebrate too much?
Well, it's understandable that governments want to protect their own nations, but there have been repeated warnings about the fact that too many parts of the world have been left unvaccinated. Less than 10% of Africa, for instance, have had their double doses. And there have been endless warnings about mutations that can evolve because there are too many people unvaccinated. And the World Health Organization has, over the past few days, been getting more and more angry about this inequity in vaccine distribution and pointing to South Africa and pointing to Omicron and sort of saying, well, we told you so and we wish we didn't have to have said this.
But there are lots of reports that Omicron might be milder in disease than Delta. I mean, are they reliable? And what does that mean? Because people might be confused by why we're trying to keep out the milder disease from the more virulent one now.
Well, I've spent a lot of today talking to different scientists. We had Professor Gupta in my piece there, and all of them are saying, do not jump the gun. You can't take South Africa alone, take the numbers from there alone, not least because the population there is much younger than it is here, for instance, and that might be why you're seeing milder disease. So they need much more data, and we're being repeatedly told that this won't come for at least another 2 or 3 weeks. So at the moment, there is little glimmers of cautious optimism, but it is right, according to the scientists I've been speaking to, that we continue this research, continue the genomic surveillance, and practice all the things that we've been told to do: masks, washing your hands, socially distancing where possible.